Anatomy 32, Chapter 24, the Digestive System, Topics, Oral Cavity and Pharynx. So, the oral cavity is where we find the mouth. Mouth includes the superior lip and the inferior lip, and then you also have this little bit of tissue called the superior labial frenulum. And then for the inferior lip, you have the inferior labial frenulum. Then, of course, there is the tongue, that large muscular structure within the oral cavity, and it has its own tissue that helps connect it down to the floor of the oral cavity called the lingual frenulum. The roof of the oral cavity is formed by the hard palate, the soft palate, and then dangling in the back is the uvula. The soft palate and the uvula are important because when we swallow, they will block the entrance to the nasal cavity, preventing the food and drink from going up into the nasal cavity. Then, of course, when we swallow, the food will need to pass from the oral cavity into the pharynx, so it'll go through the back opening for the oral cavity called the fauces. There are, of course, salivary glands that produce saliva that is secreted into the oral cavity. This includes the right and left parotid glands that are located slightly anterior to the ear that secrete into the wall of the oral cavity. You have the sublingual salivary glands that are directly under the tongue, and they have many tiny little ducts that open up and release the saliva on the floor of the oral cavity. And then you have the submandibular gland near the mandible, and its duct leads also to the floor of the oral cavity. The saliva itself is mostly water, 99.5% water, but it does have some electrolytes and enzymes, and these include lysozyme, which is an antimicrobial agent that helps to kill some microbes. Salivary amylase is an enzyme that helps to break down carbohydrates, so it engages in chemical digestion of carbohydrates. And then lingual lipase, which is inactive. But when it is active, it breaks down lipids or fats, but currently it is inactive. The tongue is a muscular structure, has many intrinsic muscles that allow us to move the tongue in many ways. And the tongue is also connected to many extrinsic muscles that also help to move the tongue, things like styloglossus, hyloglossus, etc. And then, of course, on the superior surface of the tongue are many bumps called papillae. Some contain taste buds, some do not, and they also provide some friction to the surface of the tongue to help the tongue in manipulating food in the oral cavity. There are, of course, also the teeth. Teeth are very important structures for mechanical digestion, for breaking down food into smaller chunks. The teeth can also be known as the dentes. The teeth are not bones. They are structurally different from bones, so they are not bones. If you wanted to break the tooth down in regions, you have the crown, which is above the gum line, the neck, which is at the gums, and then the root, which goes into the bone. So crown is the crown is above the gum line in the oral cavity. The neck is where the gums are, and then the roots are where the bone is. You can also look at the tooth in terms of its layers. The most superficial layer of the crown is the enamel. Enamel is the hardest substance our body can produce. Deep to the enamel is the dentin. The dentin actually forms the bulk of the tooth, giving it its shape and structure. And then finally, the pulp. Within the pulp cavity, the pulp is the living portion where we find blood vessels, lymphatic vessels, nerves, etc. We humans have two sets of teeth, or two dentitions. The deciduous or baby teeth and the permanent teeth. And so here's a child's skull where you can see the baby teeth and then the permanent teeth coming in and pushing the baby teeth out. When you look at an adult skull, you would find that the average adult should have 8 incisors, 4 on top, 4 on the bottom, 4 cuspids, 2 on top, 2 on the bottom, 8 premolars, 4 on top, 4 on the bottom, and 12 molars, 6 on top and 6 on the bottom. A lot of people have their wisdom teeth removed. The wisdom teeth is the last of the molars, so that people who have their wisdom teeth removed actually only have 8 molars instead of 12. Functions of the oral cavity. The biggest function is, of course, ingestion and mechanical digestion. So ingest, bring the food into our mouth, and mechanical digestion, chewing the food up, making it go from big pieces to small pieces, and in the process, mixing it with saliva, forming a moist lump called the bolus. So the bolus is a moist lump of food that has been chewed and mixed with saliva. Another function of the oral cavity is chemical digestion. As we know, saliva produces salivary amylase, and the amylase will begin the process of breaking down carbohydrates from big chemical structures to smaller chemical structures. We also have gustation, or the sense of taste, from the taste buds on the surface of the tongue. And then also we will need to swallow, the movement of the bolus into the pharynx, swallowing, which is officially known as degglutination. All right, some disorders. Well, there's a number of disorders associated with the teeth and gums. There's periodontal disease, which is inflammation and degeneration of the gingivae, or the gums. So they get inflamed, they bleed, they start to break down. Also can lead to breakdown of the alveolar bone, the bone tissue that's holding the tooth in place. Then there's pyorrhea, which is enlargement and inflammation of the gums and bleeding, and dental caries, which is tooth decay. And this picture here shows someone experiencing all 3 disorders: the inflammation, enlargement, and bleeding of the gums, the degeneration of the gums and alveolar bone, and very obviously the tooth decay. All right, the pharynx. The pharynx is directly after the oral cavity. We know the pharynx has 3 regions: nasopharynx, oropharynx, and laryngopharynx. For the digestive system, only the oropharynx and laryngopharynx are used by the digestive system, and during the process of swallowing, the bolus will get pushed down through the pharynx and into the esophagus being posterior to the larynx. And degglutination, swallowing, becomes a reflex after the bolus has made it to a certain point in the back of the mouth. That is it for this part of chapter 24.